Hi, I'm Dr. Swati Kumari. I'm a gynecologist, obstetrician and fertility specialist, and today I want to talk about depression. If you've been pregnant before or you're pregnant now, you may have heard about postnatal depression, postpartum blues, but I don't know how many of you have heard about antenatal depression, which is very similar to clinical depression that can occur in the antenatal period when you're pregnant. So let's talk about that. See, women are more prone to depression. It's thought that 1 in 4 women experience depression sometime during their life, and it's more common in the reproductive age group. That's why pregnancy is a time you're very susceptible, especially because during pregnancy there's also hormonal imbalances going on that can make you more susceptible. Now, who is more likely to get depression during pregnancy? Women who have undergone infertility treatment. Women who have undergone infertility treatment or assisted reproductive technology are usually more anxious regarding their pregnancy, and also maybe it's some hormonal imbalances that they face in the initial part of their pregnancy, which may make them more susceptible to depression. But it's found that women who undergo infertility treatment are more susceptible to get depression during pregnancy. And depression during pregnancy has an incidence of around 7 to 15%. Okay, other risk factors are if you've had depression before, if your family member has depression, if you have had depression in a previous pregnancy, if you undergo some big life event that's causing you a lot of anxiety, or some family member dies, something bad happens to a friend, anything like this can cause depression. Or if your pregnancy gets complicated by things like bleeding, hypertension, anything that can lead to an adverse outcome in pregnancy can also trigger depression. And the mental health aspect of pregnancy is usually ignored. It's usually misdiagnosed. Many symptoms are attributed to pregnancy rather than to depression. So the thing is that symptoms like anxiety, lack of sleep, loss of libido, low mood for a persistent period of around 2 weeks, these things should be thought of as depression, but instead they're attributed to be like, oh, these are normal pregnancy symptoms. And many women feel very guilty about feeling these things during pregnancy, because pregnancy should be a time of joy and happiness, and instead they're feeling scared and anxious. So it can happen that these subtle signs are missed by both the woman, the family members, and the healthcare providers. And I actually want to increase some awareness about this and how important it is to pick up on these signs. So what are the symptoms of depression in pregnancy? Usually these symptoms last for a duration of more than 2 weeks. Low mood, anxiety, either you sleep too much or too less, lack of libido, you eat too much or too less, and you don't want to go for antenatal follow-ups. The weight gain is not adequate. If you start smoking, drinking alcohol, or if you start taking drugs, these things can be a sign of depression, and they should not be taken lightly. Especially if a woman is in a family which is not that supportive, or if she's subject to domestic abuse, then these women are even more susceptible. Now, when depression is suspected, a proper psychiatric consultation should be done. Okay, a proper questionnaire is there for depression, and you should be evaluated in lines of depression. And if found to have depression, then there's different treatment modalities available, including diet, exercise. Exercise naturally increases serotonin and helps lift up mood, and healthy foods that are rich in omega fatty acids, plus some prescription medicines that are safe in pregnancy. Also, electroconvulsive therapy is safe in pregnancy, and all these things can help you get better in time, because women who have depression in pregnancy are also more prone to suicide. They're less likely to take care of their babies. Babies are usually low birth weight and neglected, and getting appropriate treatment at the right time can prevent all these catastrophes. Thank you. I hope this video was of some help.